How's it, guys? Today we're going to talk about ITB syndrome or iliotibial band syndrome pain. So if you've ever had pain when you're running, lunging, jumping, anything like that, and you're getting pain on the outside or lateral aspect of your knee, maybe coming up your leg and on the outside of your hip, then it could be an IT band issue. Okay, so what is the iliotibial band? It's a thick band of connective tissue on the outside of your hip, and it runs down the outside of your leg and connects down on the outer aspect of your knee. So when we struggle with alignment issues or mobility issues, this is when the knee can collapse inwards, maybe your ankle's collapsing in and your pelvis is not stable. Then we get pressure on the outside of the knee, and that causes some pain and inflammation. Now, there's a few tests that we can do to see, is it coming from mobility issues or is it coming from more of a stability issues? And I'm going to show you that now. So the two different reasons why we can get ITB pain is either mobility or stability. So if it's a stability thing, it's probably because your glutes, either your glute medius or your glute max, is not firing the way that it should. It's not activating to stabilize your knee. Both of those glute muscles have a common connection around your IT band. So if they're not working, your IT band is going to work a little bit harder to try and stabilize your leg when you're running and jumping and lunging, and so it gets overworked, and that's how it gets tight. So one of the ways that you can test that is you can just use a step at home, stand up on the step, and start with the leg that doesn't have pain, or maybe starting with your dominant leg, stand on top, balance, and then we're going to try and do a single leg squat. And the aim here is to squat down, see if you can touch the floor with your foot, come back up. If you can't, then just squat as low as you're comfortable. And what we're looking at here is your knee able to stay straight in line with the center of your foot, or does it collapse inwards? If it collapses in, then we're probably lacking stability from the hip or from the foot, but we'll focus on the hip foot today. So what we're looking for here is that you can keep your leg aligned with your foot, but if you naturally are collapsing inwards, then it could be a strength issue from your glutes or a lack of strength from your glutes. Another reason why someone might be having some pain on the outside of their knee or hip is immobility somewhere in the hip. So this test is called the FABER test. It's for rotation and abduction of the hip. So what we'll do is bend into the knee, and you can do this with a friend, you can do this with anyone at home. We're going to cross the right ankle onto the left thigh just above the knee. Let this knee just relax down, and then keeping a bit of pressure on the opposite hip just to make sure that the hips don't tilt over to the side. Now I'll keep the hips nice and stable, and then see at what point this knee stops to lower down towards the box. So that is going to show me what the right hip is doing in terms of abduction and rotation, or moving outwards. And that tells me that the inside of the groin is quite stiff. So if I look at this measurement from the box, I'm going to measure it with my hands like this. And he's got more than 2 fists of height like this. What we're looking for here is mostly to get this shin pretty parallel to the ground. And that'll give us a good mobility rating in the right hip. Let's check the other side. Okay, so just stabilizing the hips and then relaxing your leg. Good. And then again, we're checking the height of the knee from the box. And on this side, you can see a clear difference, but I would go for more mobility in both of the hips because we want the shins to be more or less parallel to the box. In order to fix your IT band root cause of why the pain is happening, we need to target exactly where it's coming from. So if you found that your mobility was an issue, so you had some tightness on the inside of your leg, or just generally in your hip, then you want to do one of these 2 exercises or both of them. That would be ideal. So the first one is you come into a low lunge position like this, a half kneeling position, and you have one foot out in front of you. So it's as if I'm going to do a hip flexor stretch. Now, from this front facing position, I'm going to walk my front leg out to about 45 degrees. Keep my pelvis facing forward. I'm squeezing the glutes, the buttocks of the back leg, the knee that's on the ground. Squeezing, and then I start to lunge in the direction of my front foot, opening up my front leg so I can feel a good stretch into the groin and the hip flexors and groin on the opposite leg as well, the one that's down on the ground. So I'm stretching the adductors and the groin of both legs at the same time, slightly different. And you can move in and out of this position, or you can hold the position going into that and just holding it there and breathing. And we'll open up the adductors, the inside of your hip. The next mobility exercise is also for the inside of the hip and groin, but also the adductors all the way down towards the knee, because now we're going to do it with a straight leg. I'll show you from the side. So on your hands and knees, and I'm taking one leg all the way out to the side, keeping it quite straight, keeping my back as lengthened as possible, and then sitting down and back towards my back foot, and I'll feel a good stretch all the way down the inside of the leg that's straight out to the side, coming forward, and I can rock back and forth a bunch of times, or I can hold the stretch position, and that's going to help to mobilize or stretch out these tight muscles on the inside of the hip and groin. Here's a front view of that same stretch, just so you can see the position of my hips, my hands, and my legs. Then if you found that stability was more your issue, so it's more of a glute activation problem and therefore the strength of your glutes need to be improved, then we can do one of these two exercises, or ideally you're doing both of them. So use a band and you can place it around your thighs. You can also do this without a band. So just above the knees, I'm going to come into a side bridge position, knees bent, elbow underneath my shoulder, lifting the hips up, and then what I'm doing here is squeezing both knees away from each other. So not just lifting the top knee open, but actually pushing the bottom knee down into the floor, and that way you'll get some really good glute medius activation. And you'll feel it to the sort of outside and upper part of your buttocks. That's what we're aiming for. You're holding this position and breathing at the same time. You can hold it open. You can also go up and down with some reps. Either one of those is going to fire up your glutes nicely, get them nice and strong. Then the next one to fire up your glutes and fix your ITB band is an abduction with the legs, but in a standing position, because we need to learn to fire the glutes in a weight-bearing position as well. That's when it's important for running, for firing the glutes during running. So the standing leg is nice and grounded. Then I'm going to slightly bend my standing knee, activate my core muscles, balance, and push this leg out to the side. Slowly bring it in. But I'm trying to push both legs in opposite directions, not just lifting this leg out to the side, because then you're going to tip over to the side. So I'm stabilizing, pushing both legs in opposite directions, and slowly coming back in. And you'll actually feel that the glutes of both legs, but especially the standing leg, work really hard to stabilize you. And the whole time I'm trying to keep my knee aligned with my foot as well, so that it doesn't drop inwards. Those are some of the important notes for ITB pain and how you can fix it. I'll put the full description of the stretches and exercises in the caption below. Please let me know how it goes or if you've got any questions.